My name is Avinash Bhakta. I'm a colorectal surgeon at the University of Kentucky Markey Cancer Center. We really wanted to see whether the Affordable Care Act and its Medicaid expansion had any impact at all on screening, incidence, and survival of colorectal cancer. We especially wanted to study this effect in our Eastern Kentucky Appalachian population. Kentucky is noted to have the highest incidence of colorectal cancer in the nation. We utilized two databases. The first database we utilized was the Kentucky Cabinet for Health and Family Registry, which gave us the screening rates for colonoscopies. The other database that we utilized was the Kentucky Cancer Registry, and it's tied directly with the Markey Cancer Center. From this database, we were able to identify the incidence and, more importantly, the survival for colorectal cancer. The increase in screening that we noted more so in the Medicaid population. We increased that screening from the pre-expansion to the post-expansion era. Appalachian Kentucky was significantly impacted by the Affordable Care Act and its Medicaid expansion because we saw increase in screening. We saw an increase in incidence of colorectal cancer, but there was a trend towards earlier stage of diagnosis. And then finally, we saw a huge impact in our survival benefit with the Affordable Care Act expansion in the Appalachian Kentucky population. I think the takeaway message for the physicians is that screening does matter. With screening, you improve survival. If patients adhere to current screening guidelines, we're able to identify colorectal cancers at earlier stages and thus have a huge impact on survival. What I want the general public to know about colorectal cancer is that it is treatable and it's also preventable. With appropriate screening, we can identify precursor lesions and treat them before they progress to cancer. We're also able to identify cancers at earlier stages, which allows us various treatment options when those cancers are detected.